Hello, everybody. We are just waiting for a few more minutes because people are just joining. So we will allow a few more minutes for the participants to join our webinar. Just a second. Hello, everybody. We are just waiting. Well, we'll be waiting one more minute so as we can allow time for the participants to link and to join the webinar. But we will start in 1 minute. Okay, we're ready to start. Hello, everybody. Thanks for being with us today for the third episode of our series on nutrition in a digital world. My name is Denise Coitinho, and I am a senior consultant on nutrition and food systems at the UNSCN. As you may know, our series comprises of 4 episodes. The first episode discussed the challenges of digital food marketing. The second one focused on how digital space is being used to inform and also to disinform on nutrition. But we also touched upon issues on how digital technologies can help building capacity for nutrition. And today, on our third episode, we will take a slightly different perspective, but a very, very interesting one. We will discuss digital technology as an enabling factor for effective nutrition action, including by facilitating the reach to most vulnerable populations, and interestingly, as means to supporting the adoption of a human rights approach to what we do. So before we start, I'll just give you some pieces of practical information. The event will be recorded, and the recordings will be made available on the UNSCN website. You can already find at our website the recordings of the 2 first episodes, if you are interested. The webinar will be held in English only, and the participants will be kept in mode mute. We also request the presenters that when you are not speaking and after you finish your presentation, you mute yourselves while the others are presenting and unmute at the end when we start our discussions. Participants, please share your questions using the question and answer feature of Zoom. If your questions is for one specific panelist, please start it with the name of the panelist because this will facilitate reply. And so we ask the panelists to keep an eye on the Q&A box to reply directly to any question posed to them if that is possible, feasible. If you have a comment and not a question, we please ask you to submit them in the chat box and not on the Q&A box to facilitate. And we will start then with presentations. We have a great lineup of speakers, and we will then conclude with all the panelists together answering your questions and in fact sharing insights between themselves. So without further ado, I would like to start welcoming Nathaniel Jensen, a senior scientist at the International Livestock Research Institute in Nairobi, Kenya. And Nathaniel will just talk with us today a bit about how to use technology to enable nutrition and health data collection in remote communities. So Nathan, the floor is yours.
Hi, everybody. I hope you can see my screen okay.
Yes, we can.
And my video is on, I believe.
All is perfect.
Okay, great. Well, thank you very much for this opportunity to present. As mentioned, my name is Nathan Jensen. I'm a scientist at the International Livestock Research Institute. And I'm an economist there, but today I'm going to be talking about nutrition and data collection a little bit. Shoot, sorry. Okay, so the challenge we identified was that health and nutrition data are, well, they're some of the most used indicators in the world for tracking things like progress against the Sustainable Development Goals, or for monitoring for humanitarian disasters, or in my work a lot, I use them for assessing the impacts of development interventions. These methods are really expensive and slow to collect. They're difficult. They required a lot of training by whoever's collecting them. You have to go to a person, you have to find the person, and then you actually have to sit down with them and collect those data. The result, or at least we argue the result, is that the data that we would like to have are usually lacking. And so it's insufficient for many different needs, including impact analysis, where maybe we see an expensive baseline and an expensive follow-up, but we don't get to see what happens in the middle. If we're worried about humanitarian disasters, we're probably monitoring for changes in malnutrition over time. But of course, these things can happen quite quickly. Seasonality, droughts, and the like. They're very quick compared to the annual type of surveys that we often collect. So there are also some particular cases where the data are especially sparse. I mentioned pastoral communities. For one reason, that's where we work, and another reason is it's shown up in the literature quite a bit recently, talking about how even in cases with such as the DHS surveys that should be quite representative of a country, we find that there's bias in DHS data around malnutrition rates among pastoral communities. And this is, of course, because they move around and it's difficult to track them. Of course, during conflict and emergency settings or pandemics, as we've seen recently, these data can be especially difficult to collect. With pandemics specifically, having a data collector that's probably coming from an urban setting, going out into these rural areas isn't a great idea because, of course, they could become a vector. So our proposed solution is to develop a mobile-based platform that caregivers can use themselves to collect the data, to record it, to submit it, and to send it. But then also the tool can actually track their submitted data there on the phone and can provide them with feedback. We can talk about the progress against international benchmarks. We can talk to them about trends in their data. And so if there's a decrease or a decline in something like a MUAC, it can flag this to them and ask them to talk to their local healthcare provider or community health volunteers in this case. So here's an example of the tool. These are some screenshots on the right, and the main features are listed on the left. For number one, of course, we're focused on collecting data from caregivers by caregivers and the children they care for. So that means we have to think about who are these caregivers. Illiteracy, of course, is going to be sort of the norm in these areas. Numeracy as well. There's not going to be cellular connectivity, so it has to work offline. And the sort of the indicators that we want to collect have to be something that the caregiver sort of understands. And we can ask those questions using things, simple things like icons or audio, those sorts of things. And it can't require a lot of tools. So things like weight for height, of course, would be really nice to collect out there, but bringing a scale out to these caregivers would be very expensive. There's a point here on focusing on dynamics over time. So this is really what we see the advantage to something like this is. We don't expect maybe the caregiver data to be as high quality for any specific data point as it would be if it was collected by a technician or a clinician. But of course, if we can get repeat measures over time, we can start to deal with any sort of biases in the data. The other important feature, of course, is that it can provide then the caregiver with feedback from their own data or the children or their children. If you look at the two screenshots down below, these are examples of some of this feedback. So the first one on the bottom left is talking about sort of the level of MUAC as well as the trend. If the caregiver were to touch that little green circle, there would be an audio reading in their local language telling them that, not only is their MUAC quite good, but it's also increasing in their child. So this is a positive outcome. If the MUAC had fallen below a certain threshold or was decreasing, it could also say those things. The one on the right is around complementary feeding of a child. Of course, the tool, the caregivers already input the age of the child, so we know the age that they should be complementary feeding. And I think an important point is that the messaging here, we acknowledge that a lot of times things like the consumption patterns of people are in part due to behavior and in part due to access. And so the messaging has been developed with the caregivers with this in mind. So it's really a reminder. We're trying to be very, very careful in how we word things. So we piloted this, it's over the last year. In fact, right now the team's out there closing the survey down, getting feedback from participants. In northern Kenya, it's a pastoral region of Kenya, among 192 caregivers. And an important thing about the pilot is that we have 22 our community health volunteers collecting the same data from these participants. So community health volunteers, or CHVs as I'll call them, are already out there collecting data from these women. This is part of the sampling process. We used women that were already part of these programs. This community health volunteer data will then be used as a benchmark data so we can understand the quality of the healthcare collected data. So our primary objective is to understand sort of, will caregivers collect this data? And if so, is the data valuable? And then finally, the third objective is to find out, do the caregivers respond to this sort of this monitoring and feedback mechanism within the tool? So moving along quite quickly, I think I'm doing good. Participation, so I'll provide you with a few preliminary results from the pilot. Participation has been great over this last year. This figure on the right, on the x-axis is just the months, and the y-axis is the number of submissions per participant per week, the mean of that actually, and the standard deviations are shown. And we see initially, of course, we were doing the training, so we're rolling in communities, so there's a lot of noise, but then quite quickly we get up between 6 and 8 submissions per participant per week. And the really interesting thing is recognizing that sort of around April, the field closed down for everybody, including the CHVs. So nobody could go to the field anymore. Data collection at ILRI, for example, ceased across all of our projects, except for this project, because the caregivers had the tool in their hand, and so they continued to collect data even during this shutdown. And then as the CHVs reactivated, they've continued to collect data. There's a really low point in June where we had to update the tool. There's some bug that sort of showed up, and we managed to do this remotely, just 100% calling people on phones. So this is a big success. We expected more sort of ICT issues to be a problem, but it worked really well. So thinking about data quality, the first thing we look at is the caregiver data, and we just look for internal consistency in that data. And this figure on the right, on the x-axis, we have consecutive reported weeks with diarrhea. And on the y-axis, we have the child recording of MUAC, so the diarrhea is for the child as well. And what we see is, of course, most of the data, the bottom figure is just a histogram of where the data lie. Most of the data, of course, is people reporting with no diarrhea. But then for some of them, we're seeing, consecutive weeks, 5, 10, 15 weeks with diarrhea, and we see MUAC falling as we expect. So this is consistent internally. If we want to compare the data to the CHV data then, so the CHVs and the caregivers are collecting the same data. This figure is getting at that. The x-axis again is time, and the y-axis is the child MUAC. In green, we have child MUAC measured by the caregivers. And in orange, we have child MUAC measured by the CHVs. What we see is there is some difference. So it seems like there's some systematic bias in how the caregivers measure MUAC. It seems like they're doing it perhaps a little loose, or maybe a little bit on the wrong part of the child's arm. I'm not sure yet, but we actually have them taking photos. And so that's the next step, is to see if we can identify why there's this bias. But the reality is a bias that occurs in all observations is really easy to control for. So we're more interested in the trend, and we see there's sort of an upward trend over this period of time. which is consistent with the environmental conditions. So basically coming off of mid-2019, they were coming off of a drought. The rains came pretty early in late 2019, and ever since it's been really good conditions out there. So even things like, even with COVID and there's locusts up there, food security scores in other surveys show that things are quite good in the region. Then the final objective was to see if there would be some sort of behavioral change around this tracking feature of the caregiver. And this figure on the right is showing, once again, time is on the x-axis, and this on the y-axis is minimum dietary diversity for the women. And so the feature that provided information back to the caregiver about her own dietary diversity was rolled out in June across all the caregivers. And so what we see is we see minimum dietary diversity before, sort of on the left part of the figure, and after on the right part of the figure. And there is a big increase there, a statistically significant increase. We have to sort of think about how to control for the seasonality, because we saw that things were getting better between these sort of the early period in the study and later period in the study. We also have to look at, was this a change in just the recording by the caregiver? Of course, she could just change what she says, or is this an actual change in behavior that we care about, which would be a change in her consumption? And so we'll be comparing this to the CHV data to see if there's sort of an equivalent jump in the minimum dietary diversity at that specific period. I mentioned over here that we do see that this jump takes place within specific food groups that our messaging was focused on. So that's also quite promising. So here I can just summarize. There's definitely a great need for data in these regions. Anybody working in pastoral regions especially, we see that doing things like impact analysis, understanding malnutrition rates is really challenging. And certainly digital platforms can facilitate some data collection and dissemination. We see many examples of that. It seems that our tool, this sort of put the tool in the caregiver's hand, so far has been very promising. It was resilient to this big disruption that we faced around field work, around sort of all of these different things related to COVID. There's changes in policies. At the same time, it's allowed us to provide communication or feedback back to these caregivers. And they've responded very positively towards it so far. They really enjoyed the feature. And I hope that as we look at the data now that the pilot's closing, that these preliminary results are confirmed in the true data. So I can stop there. Back to you.
Great. Fantastic. Thank you, Nathan. It's really a fascinating example of a good use of digital technology that in fact respond to several challenges. What I really liked is this two-way communication feature. And I would say that's something that the digital platform allows. In fact, not very common when you think about data gathering. And I think it's just so important. So really great example, well done. So to continue the conversation, then I would like to call as our next speaker, Joseph Tinarwo from the Politics and Public Management Program at Great Zimbabwe University. Joseph held also various assignments as a consultant to the government of Zimbabwe and international development partners. And he's going to continue the conversation about how digital technologies can help strengthening data systems, and especially what does it take, what the challenges are. So Joseph, the floor is yours. And if you want, you can also comment on what you just seen from what Nathan presented and see how this can perhaps help address some of the challenges that you face. So the floor is yours. We will share the presentation for you.
Thank you very much. Greetings to everyone. As Denise has introduced me, my name is Joseph from Zimbabwe in Africa.
There it goes. You have your presentation on screen.
Thank you so much, Denise, for that. My name is Joseph from Africa, Zimbabwe, to be more specific. I'm going to talk about digital technologies and how digital technologies could improve Zimbabwe's food and nutrition security information system. I think it is quite axiomatic that there are growing calls on governments around the world to establish national integrated food and nutrition security information systems. And this call is coming from different stakeholders. The main call for the establishment of food and nutrition information systems is mainly to promote evidence-based interventions. And this is also critical for the achievement of sustainable development goals. Next slide. So you find that food and nutrition security information comes from multiple stakeholders. That is from government, from the development partners, from the NGOs, from the academic researchers, and some even from the private sector. And this fragmentation often hinders the cohesive understanding and outcomes of food and nutrition security. So it then becomes very much imperative to coordinate and harmonize these data sources so that we have a holistic and complete picture of our understanding of food and nutrition security issues. And in view of that, digital technologies, it actually hosts a lot of opportunities for food and nutrition security, for the establishment of food and nutrition security information system. However, caution must be taken when adopting digital technologies, because they are not a magic bullet in their own. There are a number of challenges that programmers and policymakers need to pay attention to when adopting digital technologies in ensuring food and nutrition security interventions. So basically, the methodology that I used in this research was that it primarily followed a mixed research method survey that was conducted in November and December 2019. And a short questionnaire was actually administered to 62 representative respondents representing the government, the development partners, the NGOs, and also the academia to try and understand what are the pros and cons of applying digital technologies in building a food and nutrition security information system. So from the 12 of them were identified to as key informants to try and understand further the implications of using digital technologies. And the data that was collected, both quantitative and qualitative data, were analyzed in this way. Descriptive statistics, it was used to analyze the quantitative data that was collected from the questionnaire. And quantitative data was analyzed using thematic analysis. So let me try to give a brief background about the Zimbabwean case study. In Zimbabwe, more than half of the country's population are regarded as food and insecure. That is according to the World Food Program, where about 5.5 million of the hungry people reside in the rural areas. while it's about approximately 2.2 million in the urban areas. And with the coming in of COVID-19, the numbers could be even pushed higher. And while this hunger and is regarded as a major challenge in Zimbabwe, malnutrition is also very high, with the standing recording about 29.4%, especially to the under fives. That's according to the Zimbabwe Vulnerability Assessment Committee, which is a platform that is composed of the government itself and the UN agencies and also non-governmental organizations. So in view of the protracted hunger and malnutrition in Zimbabwe, the government of Zimbabwe adopted the Food and Nutrition Security Policy back in 2013, and commitment number 6 of the Zimbabwe Food and Nutrition Security Policy mandates the government to establish the Food and Nutrition Security Information System, mainly to prioritize and plan food and nutrition security interventions, and also to ensure prompt evidence for multi-sectoral response to food and nutrition security. The same commitment also highlights that the food and nutrition security information system is also essential in providing the different stakeholders with food and nutrition security data to guide their interventions. So these are the various data sources of information, food and nutrition security information in Zimbabwe. The Zimbabwe Demographic Health Survey, which is also done by the government together with the development partners. Then on a yearly basis, the government also conducts, with the support from the development partners, mainly the United Nations. They also do some nutritional surveillance system just to try and understand the level of malnutrition within the country. I've already mentioned the Zimbabwe Vulnerability Assessment Committee, which carries out the vulnerability in terms of food and nutrition security across the country. And this is done from time to time by the government and again, the development partners. Then there is also the agriculture and food and nutrition monitoring system. Then and also the crop and livestock assessments, which are done from time to time by the government, together with the support from the development partners, just to try and understand the food and nutrition security system within the country. So what were the findings that I discovered from this study is that digital technologies, it has a lot of opportunities. Though the Zimbabwean Food and Nutrition Security Information System is still under construction, there are a number of advantages that digital technologies bring. As I indicated, that the Food and Nutrition Security Information System in Zimbabwe is still under construction, and the initial stages were done with the support from the United Nations, particularly the Food and Nutrition, Food and Agriculture Organization, FAO, has been supporting Food and the Nutrition Council which is the main institution that is housed within the president's office, to spearhead the process of and coordinate multi-sectoral coordination of food and nutrition security. So I discovered that digital technologies considerably reduce cost of data collection. If it harmonizes all the information that is collected by the different stakeholders. Since the information will be collected and centrally housed as it is proposed by the policy. It also decreases inequalities in terms of data access, information access rather, by the different stakeholders. You find that the information access distribution amongst the different stakeholders is not even. Particularly the government of Zimbabwe is currently facing the challenge in terms of accessing, in terms of collecting data, without the support of the partners, the development of partners, because of the inherent challenges that the country is facing. Digital technologies also help a government and stakeholders to process and analyze data faster. If the central repository system is established, that will help both the government and the stakeholders to analyze the data faster, unlike if it is done by individual organizations. What are the pitfalls? What are the challenges that digital technologies can also pose? So it is quite important that the policymakers and the development partners factor in the challenges that digital technologies can bring in ensuring a reliable and sustainable food and nutrition security information system. So there is a likelihood of the challenge of exclusion and also potential job loss for some activities. If the information system is established, it means that some of the activities that were done by individual organizations can be lost. And this was actually highlighted through the findings. About 32% of them, they said that their fear and the main challenge that digital technologies can bring is that it will lead to exclusion and potential job loss. Then the other issue is also the issue of data privacy, where the data that is collected, since it will be publicly shared, the main challenge that they think digital technologies can bring is that of data privacy. Then there is another issue of cybersecurity breaches, where about 27% of the respondents highlighted that digital technologies is likely to lead to cybersecurity breaches. Then other challenges that are confronting development countries, and in particular Zimbabwe, is that Zimbabwe lacks digital infrastructure. Most of the data is collected from the remote areas that are suffering the challenge of digital infrastructure. Then another issue also is that the issue of prolonged power and electricity load shedding. You find that in Zimbabwe, we experience, as a country, we experience load shedding for more than 18 hours. And that is actually a threat to the establishment of a sustainable food and nutrition security information system. Then affordability of bandwidth data bundles, especially to the primary generators of food and nutrition security information in the remote and rural areas. Then the other challenge is also the issue of poor network coverage, and that is also very that also needs to be addressed. And as a matter of recommendations, for the country to be able to ensure a reliable and sustainable food and nutrition system, that there is need for adequate budgetary support from the government itself. Then there's also the issue of multi-stakeholder partnerships. That is, all the stakeholders must participate, including the primary information generators at the grassroots levels. Then there's also the need for robust legal and institutional framework to ensure that the food and nutrition security information system is well supported. Then the issue of good governance in data management is also very essential. It is also important to note that there is need for disaggregated data to enable action targeted to the most in need. So what's the take-home message from this research is that digital technologies could enhance the construction of a reliable food and nutrition security information in Zimbabwe. However, the government itself, together with the development partners, they need to address the issue of data quality, especially from information that is collected from the different stakeholders. Then there's also the issue of exclusion, and also the issue of data privacy and the cybersecurity breaches that I have indicated. There's also need to factor in the issue of good data governance, and also foster inclusion through targeted support. The reliance on donor support is not sustainable. Donors, though they contribute a lot to Zimbabwe's food and nutrition security terrain, it is important to ensure that it must be complemented by adequate budgetary support from the government. Thank you.
Thank you so much. Joseph, thank you so much for showing us this concrete example of the potential, but also the risks and especially the challenges of using technologies for nutrition information systems. And thank you also for reminding us that to reach out to the most in need, we need data that are disaggregated. I think that your presentation together with Nathan's presentation can really provide a lot of insights on how to move things to make sure that all these challenges are addressed. So I leave the question for you and Nathan to think about how you can look at one another presentation and see how these challenges that you raised can be addressed. Now, continue to speaking about good use of technology. I would like now to welcome Niyati Parekh, Associate Professor of Public Health Nutrition at New York University School of Global Public Health. For us today, Niyati will show another great example of using digital technology for a double duty nutrition action, reducing food waste while assisting food insecure populations. So Niyati, the floor is yours.
Thank you. Hello, everyone. It's a great pleasure to be a panelist today. I'm Niyati Parekh, and on behalf of our team at New York University, I will be discussing the role of technology to alleviating hunger and food insecurity. There's a broad audience present today, so I will begin quickly by defining food insecurity. According to the FAO, food insecurity is the lack of consistent physical and economic access to sufficient, safe, and nutritious foods for an active and healthy life. Note how both quantity and quality of food are emphasized in this definition. Contrary to what might be widely perceived, even prior to the pandemic, 1 in 9 Americans were food insecure, accounting for 37 million people. The meal gap, defined as the shortfall of meals to feed the population adequately, was estimated to be 7 billion meals annually in the US. The US Department of Agriculture categorizes food insecurity into 4 levels as seen on this triangle. It is the low food security and the very low food security groups that are of concern, represented by the dark yellow, the dark orange and the red parts of the triangle. Low food security is characterized by sufficient quantity of food, but the quality is compromised. And in the very low food security group shown in red, 1 or more members of the household experience disruptions in food intake, food quality and quantity are compromised, and the household experiences a lack of food as well as resources to obtain it. In the US, food insecurity is associated with excess weight and prevalence of chronic diseases. The poorest and hungriest neighborhoods have disproportionately have higher rates of obesity. They have the lowest fruit and vegetable intake and high intakes of sugary beverages and cheap and readily available processed foods. There is no doubt that the pandemic has worsened this situation. Early evidence from reports during the pandemic and various expert sources have suggested that the sales of frozen food, frozen pizza, poultry, frozen dinners, and a variety of snack foods, including pretzels and comfort foods such as mac and cheese found in packages, have spiked. The sales of these foods have spiked in the US. I will now focus on the concern of food insecurity among the youth on college campuses. There have been many expert reports from college surveys that find more than 50% of students in the United States face food insecurity, with 20% reporting very low food security levels, qualifying them as hungry. There's a rapidly changing demographic on college campuses with students of color and non-traditional students such as first-generation students who are enrolling. Reports have shown that students of color face more food insecurity, such as Blacks, Latinos, and Asians, ranging from 45 to 60%. Food insecurity coexists with housing insecurity, accounting for 60% that experience both. So this also means they don't necessarily have a place to cook and prepare their meals. Neither student efforts to earn money by doing jobs nor financial aid have been entirely successful in solving the food insecurity crisis on campuses. Over 50% of students, based on these surveys, are opting out of extracurricular activities. They're not buying textbooks, and a quarter of them have dropped out of classes. COVID has increased food insecurity around the US. This is a picture from a news channel covering food insecurity with images of long lines of people and cars waiting for hours for food outside food pantries and food banks. So the team at NYU designed an app to combat this issue of food insecurity on campuses. Interestingly, the Food to Share app, that's what it's called, has 3 interfaces. The NYU community mobile interface, meant for students, staff, and faculty. They can use this app to order the food for themselves, and they get a small discount of 10%. But at the same time, they have the option of ordering extra food and buying extra food with a 50% discount for someone else in need. Then you have the rest. The second interface is the restaurant web-based interface, where they're able to offer the discount of 10% to the NYU community. Then they can also offer the 50% discounted items. And they may also donate 100% discounted food items if they feel at the end of the day that food is going to go to waste. And the last interface is for students who are feeling the need to get food, or those who are insecure, food insecure, to actually order the food. So how does the app work? It's pretty user-friendly. Basically, they go to the restaurant, place the order, claim the food, and pick it up within about 45 minutes. This is another picture. They can select the restaurant by using a map or the cuisine or the category of the restaurant, and then they can claim the donated food. So the one neat aspect of this app is that it also offers the opportunity to provide healthy tips, providing nutrition literacy, and helps them make healthy choices through the educational aspects of this app. The other unique feature, I think, is the annual donation report. So that means donors and restaurants and individual donors can actually get tax benefits depending on how much they have donated. So there is a financial benefit to this. And I want to spend a few minutes speaking of the overall benefits of this app and how it fits into the bigger picture. So the app fosters community engagement to address campus food insecurity through multiple partnerships by really connecting stakeholders and local communities. Importantly, it eliminates stigma because students who are insecure will never be identified and they can freely pick up the food that they need. It provides tax incentives that I just discussed in the previous slide. And the next point is, about reducing food waste. I feel that this entire presentation could also be spoken about in the context of food waste and a strategy for reducing food waste in this country and even globally, because this app can be modified and utilized in other settings. So, there are lots of reports about the amount of food waste in the United States, but the bottom line is that it's almost 700 billion worth of food waste happening in this country every year. The proliferation of food industry and its new retail formats in emerging economies and the omnipresence of highly processed foods will intensify retail and consumer level food waste even globally. So I think this app could really work very well to reduce food waste and put it on someone's plate as meals, So while this app is being in its final stages of development and testing here on this campus and eventually other campuses, potentially it has a lot of capabilities of being country specific and context specific. And the ability to scale up using this app is going to be tremendous. We could also extend it from restaurants to supermarket and food institution type of settings, and also connect farmers to some of these food outlets. So I think I'll kind of stop at that, and over to you, Denise. Happy to take questions. I'm sorry, I wanted to thank our team. Ayan Dogan, who's actually the person who's designed this app, and Joyce O'Connor. And with this, I'm happy to take questions. Thank you so much.
Thank you so much, Niyati. It is really an incredible and in fact scalable idea that you have put in place. And what I really liked about it is that it, as you said, it fosters partnerships, community engagement, but it also fosters solidarity. And I think that as Joseph has just said, when we think about big information systems, we really have to look at disaggregated data to try and then make all these linkages with apps that are there that can make help in different, so for everyone to think, and then we will discuss it at the end, how we can link up more of these tools with information systems and really to reach the most in need. So thank you so much. So along the same lines, and also focusing on the potential of technical technologies to reach to the often neglected populations, and also supporting solidarity, Zaina Makhul will present to us another great app for improving nutrition of children with disabilities. Zaina is a nutrition scientist at Spoon, which is an organization working in many countries to nourish highly vulnerable children by empowering their caregivers. So Zaina, the floor is yours.
Thank you, Denise, and thank you, UNSCN team, for this wonderful opportunity and platform. Today is actually International Day of Persons with disabilities, so it's a perfect day to speak about this topic. I will be talking about the value that digital technology can bring to reach children with disabilities with quality nutrition care. And I will highlight some key considerations based on Spoon's experience implementing two of our tools, an mHealth app called Count Me In, and our e-learning training on adapted nutrition and feeding care. There are 291 million children with developmental disabilities worldwide, and this estimate includes epilepsy, intellectual disabilities, hearing loss, and vision loss, and it's considered to be a conservative number because it does not include all types of disabilities. The majority of these children, 95% of them, live in low and middle income countries where they are likely to face multiple vulnerabilities and barriers that increase their likelihood to develop malnutrition. And in fact, overall, children with disabilities are 3 times more likely to be malnourished and twice as likely to die from malnutrition compared to children without disabilities. Those who have feeding difficulties are particularly vulnerable to malnutrition. As many as 85% of children with developmental disabilities experience feeding difficulties that can include anything from delayed feeding skills to trouble sitting upright for feeding to difficulty swallowing and chewing, among many others. And all of these challenges can place them at risk for respiratory illnesses, for undernutrition, secondary impairments. And then one can imagine how these challenges can disrupt the child's participation in social activities, family functioning, and overall quality of life. This dynamic between malnutrition and disability is not only during childhood, but it's at play throughout a child's life and is really impacted by the many barriers that they face. One of those barriers is strong stigma and discrimination, but also mainstream nutrition services are often not inclusive of children with disabilities. There's also a low availability of a skilled workforce that is skilled in adapted care and is able to provide disability-specific nutrition services. Then there's the issue of data. We're talking today about the importance of data-driven decision-making, and this is a huge gap for children with disabilities. This group of kids are often not included in population-wide surveys and national surveys, and that renders them invisible to funders, to policymakers. And it also limits our understanding of their needs and their nutritional status. So then we're unable to have data-driven accountability measures in place. And then lastly, an inclusive policy environment, whether at the global or national level, is still in its infancy in order to address all of these barriers. So a policy environment that is promoting data collection, filling gaps in a workforce, and making sure children with disabilities are included in nutrition and related sectors is still not sufficient. Because of all of these barriers, and of course now with the pandemic, these kids and their families are facing exceptionally difficult circumstances. Fortunately, currently our sector is experiencing 2 important trends. One of them is the Leave No One Behind and equity in nutrition, and that has been gaining speed and steam. And there's also our now understanding of how we can use technology to reach different audiences and different populations with more effective interventions in order to achieve the SDG targets. In our publication in our UNSCN paper, we looked at how our sector is doing in leveraging technology in order to reach children with disabilities with quality nutrition care. And next, I'll talk about 3 ways in which we see nutrition and technology, how they can come together for children with disabilities to strengthen healthcare delivery, to fill in gaps in workforce, and to fill in gaps in data and evidence. The benefits of mHealth technology has not been fully leveraged for children with disabilities. We know that technology can have an important role in data-driven decision making, and mHealth can have a particular value in clinical care for children with disability, especially where a skilled workforce is not available in order to tackle some of the nuanced and complex feeding challenges for children with disabilities. For example, thinking about a child we met in one of our projects, Beatrice. Beatrice has cerebral palsy. She has difficulty sitting upright. She has difficulty swallowing. She has the feeding skills of a 1-year-old while she's 5. And also she is malnourished. And for Beatrice to be successful, we have to design individualized care plans that are adapted to her needs and that are able to address each one of her challenges. And Spoon's app, Count Me In, it has logic in it that is able to guide a community health worker who is not a feeding specialist in assessing Beatrice's feeding difficulties and then designing an individualized care plan for her. So we are able to distill some of the complex clinical decision-making into simple questions for someone who doesn't have the background or the specialty to be able to follow and provide adequate and quality care. So an example, Count Me In contains a feeding screener that will take into account Beatrice's diagnosis, age, growth status, and feeding skills, and then generate practical recommendations and a series of observations in order to further assess her. It also can generate data, so we're able to track nutrition outcomes and feeding outcomes for Beatrice and other children. So we're able to gain better understanding of trends for this population. And because children with disabilities are not a homogeneous group and they have widely varying needs, we see a great potential for mHealth technology being an enabling factor to reach this population with quality healthcare, especially in resource-limited settings. Another way technology can help children with disabilities is through e-learning. E-learning can fill knowledge and skill gaps of the existing workforce, so they are able to sustain and facilitate the scale-up of inclusive services. 2 weeks ago, in the second episode of this webinar series, the speakers shared the barriers and their recommendations around online learning. And based on our experience at Spoon with disseminating online training on adapted nutrition and feeding care, we share some of those same challenges and agree with the recommendations there that were made. So if you haven't listened to that webinar, I encourage you to. I also would like to highlight a couple more points. We have found that a foundational package around disability and nutrition is able to provide a common language and understanding of disability and the intersection of disability and nutrition, and to debunk some of the misconceptions that, that exist around disability. And because the care of children with disabilities tend to be complex, the coordination of multiple sectors, collaboration with multiple sectors is really important, whether it's nutrition, social work, social protection, that's really important. And also being able to make your delivery model very flexible in order to reach a wide audience and address the needs of different types of learners. I also want to stress the importance of understanding the limits of what you are able to train on using an online platform, and what you can responsibly train on using an online platform, given the complexities of the needs that some children with disabilities have. Both of these technologies, mHealth and e-learning, have the potential to fill data and evidence gaps. And they can help us understand the learning needs of the workforce, the nutritional status of children with disabilities, and to really understand the degree of exclusion of children with disabilities from nutrition services. And with that information, we can then set realistic targets, we can measure progress, we can have accountability, and hopefully we can encourage investments and commitments to deliberately support children with disabilities. Now, this is all great, that technology can be this enabling factor, but digital technology to improve nutrition for children with disabilities can only be successful and can only meet its potential if the system at large is inclusive. As we move more interventions, especially nutrition interventions, to digital delivery, if we simply digitize the existing systems, we risk increasing inequity. And adding a new tool will have a change, an inclusive tool can have a change, but we're not going to be able to see this change at scale unless we have an inclusive policy environment, investments that prioritize children with disabilities, a coordinated workforce that is well-resourced and skilled in addressing the needs and identifying the needs for children with disabilities, and also data that can hold all of us accountable, especially policymakers and decision makers. And so to actors in nutrition sector and related sectors, I encourage you to evaluate your programs for inclusion, to be intentional about inclusion, and to collaborate with colleagues and organizations who specialize in disability, because it is a big challenge, and we have to join forces together in order to see any real progress. And thank you for your attention. I'm happy to answer any questions if you contact me or after everyone is done with their talks. Thanks. Over to you, Denise.
Thank you. Thank you so much. Again, it's a very beautiful and scalable nutrition solution, demonstrating this potential. And also thank you for your insights on what it takes, because as we've seen on the previous presentations, there's a huge potential that we can tap on, especially if we can make more linkages between the different tools that we have out there. But if the focus is on inclusion, and if the focus is on reaching out the most in need, we can make a difference if we look at the challenges and address them. So to finalize our round of presentations, I have the pleasure of calling Professor George Kent, Professor Emeritus in the University of Hawaii, Department of Political Science. Professor Kent has collaborated with FAO, UNICEF, WFP, and with us, the UNSCN, along the years, always firmly advocating for the need of adopting a human rights perspective in nutrition. So please tell us some of your insights on how digital technologies can help all of this that we are talking about now from a human rights angle. So the floor is yours. And you have to unmute yourself.
I went to share screen, my PowerPoint is not there. Can you bring it up from your end?
Yes, we can. Cleo, can you please share the screen?
There it is.
There it goes.
Okay, thank you. This title expresses my core focus in this conversation. It's transforming nutrition goals into nutrition rights, because that could change the way of thinking about the task at hand and how to put the pieces together. A slide. I want us to think first about what are rights, and I'm talking about any kind of a rights system, whether it's the global human rights system or a local rights system locally invented, perhaps in a single hospital or prison or school. Any rights system, any well-functioning rights system has three major components: the rights holders and their rights, which need to be clearly articulated. What are they entitled to? Second, there's duty bearers, the people who have the obligation to deliver, to fulfill those rights. And then third, methods of accountability to ensure that the duty bearers fulfill their obligations. That's the idealization of rights systems. One of them is the international human rights system based on the treaties we know about, but that's just one example of a rights system. I want to suggest that thinking of rights is in terms of rights rather than goals can be useful. And the reason I focus on this is in looking at many of the programs that set up particular goals. They do a lot of nice data collection on what the problems are, and they specify the goal in some way, but they don't spell out the strategy from getting from where we are to where we want to be, from getting to the destination. I, in particular, have looked at the many claims of efforts to end hunger in the world, and this is particularly in Development Goal 2, but I haven't seen a strategy that leads me to believe that it will be achieved. And very often the strategy is simply not spelled out. So what the result is, you get doing a bit of benefit here and a bit of benefit there, but not a system for getting to the destination. Slide. The key is that in rights-based systems, you have the accountability issue to help steer the entire system toward the goal. And that's about having mid-course corrections on the pathway toward the goal. So you have a monitoring system, which many people even today have talked about, but that is, in most cases, is not tightly linked to the control system. That is the set of remedies that are required to keep you in the lane that's needed to get you in the destination. And sometimes we talk about radical large-scale interventions as basically one-off events. I think it's also important to think about control in terms of what you might call nudging, to keep the participants, the actors, on track, doing the right thing and not zero things and not doing any harm. Slide. So we can look at the human right to adequate nutrition as it's spelled out at the global level. The right to adequate food is realized when every man, woman, and child, alone or in community with others, has physical and economic access at all times to adequate food or means for its procurement. The question of whether there's a real commitment to that and how to achieve that goal, to realize that goal, is left to the national level, and its application is very uneven, very uneven. And if you look at the national level plans, these strategies again are absent, or let's say crude. Slide. So I thought it'd be useful to look at the application of the rights orientation to the issue of stunting and wasting in young children. And the most prominent, the biggest incidence of number of children stunting and wasting is in India. And they already have a system in place, the Integrated Child Development Services, which could be a good means for not only carrying out the child care services it already does, but also by acting as the duty bearer to fulfill children's right to not be stunted or wasted. Think of it as a right. And in a way, it's not complicated conceptually. Slide. In India, they've done some beautiful data gathering on stunting and wasting. Here's some mapping of stunting across the country. And this map is just one of a series of 4 about the status of it in different years. The coloring is very useful. It tells where there's high prevalence and also where there's low prevalence. And if you look at the series of maps, you can see the change over time. But this comes from annual data gathering. So it's not a very good steering mechanism for what we should be doing day to day, month to month. One other point about this map is it includes not only levels of stunting, but also rates of reduction, what they call ROR, if you can read it. And that's a hugely important indicator in trying to decide when you're trying to allocate resources to achieving a goal. You want to know not only where you are at the moment, the level, but sort of the speed of progress toward the destination. Slide. So one of the concerns and one of the reasons I'm interested in the rate of reduction is the current system of offering assistance to poor people is often based on their level of poverty or their level of food security. That has the unfortunate consequence of rewarding being poor. And it tends to lock people into that position. We can see that in welfare programs in high-income countries and on a massive scale in India, I think, where people at a certain level have given up and want to stay on getting that support. Introducing the rate of reduction into the calculation changes the calculus, because then you're rewarding the climb out of poverty. And I think it's important to think of that, of how to end the problem and not simply figure out how to live with the problem on an endless basis. Slide. So they use Anganwadis, child care centers in the Indian ICDS program. And that could be used in a very systematic way by if there was let's say monthly data collected on stunting and wasting at the Anganwadi level, at the state level. And that tells you where the resources need to go. And that would be the strategy, constantly reconfiguring the allocation of resources, the allocation of effort to moving progressively toward the goal of bringing stunting and wasting to very, very low, near zero levels. One of the things that could be triggered on a steady basis is doing things, simple things, like providing praise for those who are doing well in reducing state stunting and wasting in their particular jurisdictions. For the people who are not doing so well, you perhaps want to have more private discussions with them, saying, you know, here's what the numbers are saying. Let's talk about them. Here's some suggestions about how you can do things better at your level, at your position in this larger system. So you kind of nudge them into their lane as they drift outward. It's a constant feedback, and it's affirmation for people who are doing it right, constant affirmation for that, and correction, small scale, steady small scale corrections in the services that are provided to assure that you are moving toward a goal at a satisfying speed and in the proper direction. So far in digital technology, we've emphasized the collecting of data and describing the dimensions of the problems, but that has not been tightly linked to the remedies, which is what's required in steering and what's required by the accountability piece in rights orientation. And I think I have one more slide. Or two more. So this is, that previous slide was from a quote from a previous webinar in this series. And it was talked about the various pieces that we are involved with in monitoring data and empowering different stakeholders and so on. But I'm suggesting that the rights framework, not necessarily the human rights framework, the rights framework gives you the possibility of effective steering toward nutrition goals based on a data-rich digital system that is used to help its managers design and deploy remedies to where they are needed. The data should be fine-grained in the sense that it supports local as well as national and global aggregation of the data, thus empowering local actors, not just national and global actors. And with that, I just need a bit of affirmation, and I'm finished with my slide presentation. That's it.
Thank you. Thank you for your great insights. And I think I will now invite you all to, we had several questions that were answered in our question and answer box. But I wanted to use our time, the time we have left, for really asking you to reflect based on these great examples of reaching out to marginalized populations, trying to think out how to put nutrition and technology, making them come together in a human rights perspective, to get inspired by the key message of transforming nutrition goals into nutrition rights. And so I have a question to all of you. Can we consider internet access as an enabling factor for the realization of the human right to food? If that is the case, how do you deal in your own work and apps you've been developing with the right of privacy, knowing that all human rights are indivisible? And literacy. Another point you all gave, and the reason why we put you all together in this, although you touched on very different aspects of things, a commonality is what George just said at the end. You try to link data to remedies and to accountability mechanisms. You try to do that in your different, from your different angles. So again, how can we consider the internet access as this enabling factor? And how can we call upon, for example, tech giants to be more serious about access and digital inclusion for nutrition? So I just leave these questions and other comments that you want to make. And I'll start with Nathan for your final insights.
Yeah, thank you very much. And yes, this was very inspiring. So thank you to all the speakers for your presentations. For the work that I do, internet access is, of course, very important. I mean, we rely on these tools in the case of the app that we use to transmit the data from the phones to our servers so that we can track progress. But we can't assume that it's there. So a lot of people live without internet access for sure. Most of our caregivers, in fact, live in a place where there's no connectivity at all. But the reality actually in northern Kenya is that most larger communities, or like these middle-sized ones with any sort of market, will have internet connectivity. And it seems that they benefited from some of the large developments around building roads. And so it seems that when institutions come in and build roads, they often put in cellular towers next to it. I can say in my house here, I live in a community in upstate New York right now is where I'm at, and there's no cellular connectivity at all. But there's coaxial cable, so this is a different approach. Privacy issues are clearly very important, and this is one thing that I find challenging about privacy issues is that every time we have sort of a new advancement with technology, we have to try to keep up as researchers to make sure that we're paying attention to it and doing what we need to around it. And it's hard to keep up. So it's very nice to have people within the tech industry that are also very, very keyed in on the privacy issues so they can help provide us with some advice. For literacy and marginalized communities, I think that's certainly a place where I think many of our tools are coming in to try to address where we see, digital tools have already been used to in many cases to provide services or to people that are not so marginalized. And so, many of the talks today were about people trying to extend the reach of these digital tools to more marginalized communities. And I'll end with that. Thank you very much, everybody.
Thank you. Great insights. Can I call upon Zaina to continue the conversation?
Yeah, sure. Thank you, Denise. I definitely think access to internet is a rights issue because it has the potential to increase inequities or decrease them. I think rights holders should be demanding for their rights to access to internet, and duty bearers should be fulfilling these rights. And when those come together, we could make real progress. With the question of privacy at Spoon, because we, through our apps, we're collecting data on children. We work with attorneys from each of the countries we're involved in to understand what the privacy laws and regulations are in each of the countries. And we work closely with the ministries, relevant ministries, in order to stay within the regulations in each of these countries. And then for literacy, I think it's important to understand the audience. I think there has been examples that were shared last episode and this episode from Nathaniel, where there are some technologies that require low literacy, But I think understanding your audience and making sure you're developing a tool that address their needs and fits within their capabilities. But also it's the systems at large that needs to be enabling. So again, I don't think digital technology on its own can solve all of these issues, especially for children with disabilities. There are so many barriers that has to be tackled for digital technologies to be successful. Thank you.
Thank you so much. Niyati, what do you want to add?
Well, I think a lot of the comments that the other speakers have said, I resonate. So I'll just probably go to the literacy piece. It kind of was something I was thinking about when one of the participants asked. So I've worked in resource poor settings. I grew up in India. There was, sometimes not even basic literacy, and now here in the United States. And I really want to say that some interventions, with a lot of pictures and with a lot of graphics, we were still able to do it in a very different context. It had to be very tailored. We worked closely with community workers and people who were local, and it just had to be different, but it was still possible. So to understand the audience, like as Zaina said, I think is very critical. Wi-Fi being essential, again, when you ask that question, absolutely yes, because think about if this whole COVID pandemic had even happened years ago without technology. I think we would have fallen flat on our faces. We wouldn't have been able to continue even this amount of, normalcy without it. So certainly, yes. I think it's really becoming one of the most essential pieces of our lives, whether it's schools, kids going to school, connecting all of us, continuing research, anything. The only thing I will say about privacy is I don't know. I don't have any knowledge and any training in that area. And it's a burning question for me also. I really don't have any expertise in the computer IT behind the scenes, all the scary coding that goes on. So that's a great question, but my sense is that it's people are always ahead of the curve who are working in these areas, and they are more actively, understanding and forecasting what the problems can be. And I believe it's getting better, maybe in some places more than others, but I just think it's a concern, and I can't answer that part. Thank you.
Thank you. I think you did answer.
Okay.
Joseph, now I wanted to leave you after their insights because I have a specific question on privacy. Because in your survey, 41% of the respondents were aware of privacy issues, as you've shown, and they are so crucial and so important. So how do you respond to that? I mean, why only for 40%? Did you find that it surprised you to have that not everyone was aware of privacy issues and cybersecurity as well? So what are your views on how important these issues are for people and for information systems?
Thank you very much, Denise. I think this is really a big challenge. I'm speaking maybe on in light of where I come from here in Zimbabwe. You find that the challenge emanates from a lot of mistrust between the stakeholders themselves. So to the extent that they will not be willing to share the information, that is, especially if there is no good relationship between the different stakeholders that are involved. I'm referring to the government. There is a lot of mistrust between the different stakeholders. The issue of privacy becomes really a big issue. So what is important is for the stakeholders to have a common consensus that really the information generation is important for the benefit of the most for the underprivileged and for those who are in most in need. So it is very, very important that the policymakers, together with the development partners, ensure that the issue of privacy is observed. I'm speaking specifically in terms of creating the central repository, the information system, where information from the different stakeholders is now brought in one basket. So that can be problematic, and that needs to be addressed, because certain information, the way it is generated is different, and different stakeholders, they have different intentions as far as how the information is used. Then on the issue of cybersecurity, it is also very much critical that it must be addressed before, with the consensus of all the stakeholders. I think that's what I can say.
Thank you. I think you really looked at these things into your survey. So I think this is a very important insight. So George, to finalize now, please give us your inspirational insights, especially on how can, as I said, if digital technologies are such an enabling factor for the progressive realization of the right to food, how can we make this more clearly and put this into the movement and make sure tech giants respond to it and help with the digital divide and all these other issues?
Thank you. This relates to the discussion we've just had about the privacy issue. I think the privacy issue comes up when, especially when one has the feeling is these people in suits who came in on an airplane are asking me for information that they're going to take away to the capital city and make some decisions, and then they're going to drop an intervention on me. And they're not going to ask me my opinion about what really needs to be done. They're not going to sit down and have a real discussion with me to see what my concerns are. Too often you have the people coming in on the airplane not with the solution and even with the problem. They articulate the problems in technical ways that are not the local people's way. And so I think that one way to overcome that privacy concern is to have data available for local decision makers as well as national level, external ones. So if the local people are actively engaged in the decision-making process and see the benefits of this digitalization coming to them directly, not as a gift from somebody from far away, that I think changes the perception very radically and changes the shape of the privacy concerns. So I do think, as I said, more broadly, beyond the privacy concerns, I think we need to connect the data gathering that focuses on the dimensions of the problem, which we're really quite good at, and we can make pretty maps, but we're not using them in a way that engages local actors as people who are at the front lines of solving their own problems. And so I go to a Nigerian observer's point that the question is not how to do charity better. The question is how to make charity unnecessary so that people aren't always living on the edge. So this is why I think the rights orientation is more productive than the sort of simple goal orientation.
Thank you. Thank you. Thank you very much indeed. Well, thank you, everyone. We reached our the end of our webinar. I really thank you so much for, first of all, for having contributed to our UN SCM Nutrition 45. It was very well received by our audience, and we received great feedback of all papers. So thank you so much for having contributed to it, and now contributing to the continuity of the dialogue around these issues. Just to finalize, I want to remind everyone that FAO is organizing another webinar on the 14th called Our Basic Texts, Raising Levels of Nutrition, FAO's Contribution to Global Nutrition. It will be quite interesting. At the beginning of the chat, the link is there for the ones that are interested in registering. We recommend, because it will be really interesting insights that will be provided at this other webinar. And our last webinar of our series, the 4th, will take place on the 17th. And so we hope to see you there as well. So thank you so much. The link for registration for the 4th webinar is also placed there, and the link to our publication. So thank you very much again. And it was really a pleasure and a privilege to have you all here with us today. Bye.
Thank you.
Thank you. Thank you. Thank you all. Aloha.
Aloha.
Thank you.
Bye-bye.